I am Dr. Sandeep Govil. Will be starting the psychiatry class, and today we discuss the INI-CET 2020. So it is the first time the INI-CET has been conducted. So welcome Dr. Saab who joined us on this platform of YouTube. So if you remember, out of the 10 questions, out of the 10 question, we could able to predict the 6 or 7. If you have done our class of the predictive MCQ, you will see that already we could predict but let's now enjoy the learning. So a brief about us. I am Dr. Sandeep Govil, psychiatry faculty for last 15 years, and I have been teaching psychiatry for the various FMG exam and PG examination, and trained by the best teacher of psychiatry, and we run a ritual of free classes of psychiatry on every Thursday, Saturday, Sunday. So we are doing the learning the psychiatry on the Thursday, Saturday, Sunday. So we are doing the free classes of various psychiatry topics to 12 a.m. Also, we are doing the YouTube as a ritual on the Tuesday and Friday, 10:30 p.m. So that is the ritual we kept for psychiatry from my side. See, the benefit of the plus subscription is that's a free classes section. But if you join the plus subscription, you will have a good evening, Doctor. So we have our daily live classes, structured courses, live test and quizzes, and the unlimited access. There is no limit to the access. You can watch anytime you wish. You can download the PDF anytime you wish. Also, we offer at this platform the iconic subscription for the NEET PG and AIMS and INI-CET, which is the best of the Unacademy and best of the prep ladder. So we have the live classes and batch courses and live test and quizzes in the Unacademy, and the video recorded lectures and the rapid revision courses on the prep ladder. So T20 is over, but we played daily T20 at the championship series in the NEET PG 2022 and 2021. So 8 p.m. we have the NEET PG 2021, and 9 p.m. we do a daily live test for the 2022. So that's a ritual we have discussed already. So simple way to download the app is go to the Google Play Store, download the Unacademy Learning app and open it up. Look for section of NEET PG, and then you can choose the iconic subscription, which basically is around 55,000. So if you apply my code drsandeep10, that will be you will get a discount of 10%. Also you can apply drsandeep YT or drsandeep10. So it will be a complete discount of 10%. So that's what one of the revision course we did the FMG. So you can unlock even for the free plan. Now system has changed. Even for the free plan, you have to, if you want to start with my class, you have to start with drsandeep10 and download the Unacademy app. So you can still use the code, and we are revising the whole of 19 subjects with the top educators. We have legendary Dr. Devesh Mishra for pathology, Dr. Vaishnavi for ENT. Everybody is good, but Dr. Khatri, Dr. Puneet Bhujani, they are all the known names. Dr. Bora, Dr. Atul Gupta. So one and the best of the best we had at the platform of Unacademy. So this is our intensive revision batch. So there will be a final revision, image-based questions and previous year questions. We discuss a lot at the platform of the YouTube and the free live classes, but that's a revision, complete revision of 19 subject at a composite plan. So let's start the questions. हाँ, तो घर वाले नहीं मान रहे हैं, तो that is the best time to join the Unacademy. Be at home, learn from the comfort of your home, from the comfort of your study room or the room, or any place you can learn all the 19 subject. So now let's do the MCQ. All of the following are the good prognostic factors in schizophrenia, except good prognostic factor, Dr. Sahab nahi, Dhritarashtra ji. It is the late onset, depression, positive symptom, they are the good prognostic factor. Answer is the C. Insidious onset of the symptoms. So we remember the table that, so there are one table for two things. Professor T.J. Crow, you remember, in 1980 has described this schizophrenia into type 1 schizophrenia and type 2 schizophrenia. We say it's a important table because if you remember this table, we can handle the MCQs of type 1 and type 2, and also freely we learn the MCQs of good and the bad prognosis. Yeah, don't worry, don't be hurried. So we say acute onset. He say acute onset, usually after a precipitating event. I lost my exam, I lost my some family members, and I become depressed, I become illness. After a precipitating event, it will be a and predominantly we have the positive symptom, that is the type A. So we all know the answer. कोई answer तो दिया नहीं. Answer was the insidious onset. Positive symptom, no family history. Some of my emotions are being preserved. Emotions are being preserved. And there is a no CT scan MRI finding. It's a good prognosis schizophrenia. Type 1 schizophrenia. Type 2 on the other hand is a insidious onset. It's a gradual onset. As such, there is no precipitating factor. Predominantly, we have a negative symptom. Family history is also present. When I tell you negative symptoms are predominant, you already understand. Emotions are gone. There are some accidental or incidental CT scan MRI finding, and it's a poor prognosis. So image is blurred or it is blurred in my mobile only? So respond, because it seems to be very clear earlier. So please guide us. सब लोग चले गए ब्लर इमेज के चक्कर में लगता है. So we just say somebody married at some point, female gender and late age of onset of schizophrenia. What is late age of onset? After 45 years of age. So probably my mobile or something is problem, but okay, if it is okay to you, very good, very good. Thank you so much, Aksa. So that's a complete table. So acute onset, precipitating event, positive symptom, no family history, emotion preserved, no CT scan MRI finding, and somebody married, female gender will be a complete table for the good prognosis. In type 2 we have a somebody having schizoid personality. Just at these 2 points, somebody having schizoid personality and presence of the soft neurological signs. Presence of the soft neurological signs indicate the poor prognosis. Presence of the soft neurological signs indicate the poor prognosis. ठीक है राजा? So that is a complete table for the type 1, type 2, and adding these 2 points in the type 2, it will be a complete table for the poor prognosis. So insidious onset, negative symptom, that will be a complete table for the poor prognostic factors. So that's the first question. Now, which of the following are the subcortical dementia? We know the subcortical dementias are basically when predominantly the subcortical structures are involved, and we know the various subcortical structures are the basal ganglion, limbic system, and so on. And we know diseases involving the basal ganglions are A, B, C. Pick's disease is a frontotemporal dementia. It's a frontotemporal dementia. It's a ABC only. ठीक है डॉक्टर साहब? We know cortical and the Alzheimer's, Pick's disease. Here we add the other subcortical types are the HIV related dementia, supranuclear palsy dementia, and vascular dementia. Be possible. No, that's up. They are same. Parkinson's, Wilson's, Huntington, they are all the disorders of the basal ganglion. So we know answer is the A, B, C. Choice A, where they are all three are correct. Very good, Dr. Kiran. So the PICS is the frontotemporal type, but this I collected that HIV dementia, supranuclear palsy dementia, the vascular dementias are all under the category of a subcortical dementia. Now that's a question we predicted already. आपको याद है ये दो सवाल हम तो 3 में से 2 सवाल प्रेडिक्ट कर चुके थे पहले ही कि we'll have a 1 MCQ on the. So please, you also joined. Dr. You are so many here, 17. You can join us for the Unacademy free class tomorrow. Tomorrow we are doing the revision class, and on Sunday we are doing the sleep disorder and the medico-legal psychiatry. No. Answer is the mirtazapine and the bupropion. So we know that antidepressant has a side effect of the sexual side effect in the form of delayed ejaculation. So answer here is the not C, that's a no. Imipramine also is basically both blocker of both reuptake inhibitor, noradrenaline and the serotonin, दोनों का रीअपटेक इनहिबिटर है. ठीक है डॉक्टर साहब. This we already predicted. If you remember, we have discussed in the predicted MCQ in the free classes. Now this is a case of a male patient who lost his job recently, following which he became irritable and had a sad mood. Thoughts of job and future would make his mood even worse. So he was irritated at the family members, but occasionally he will go to the movie with a friend and able to enjoy with them. But the moment he comes back home, he'll have a similar symptom. So we know the answer is a नहीं. डॉक्टर साहब सवाल का जवाब क्या है? ताली तो बच गया. सवाल का जवाब है बी. वेरी गुड डॉक्टर सुबिन. इट्स अ adjustment disorder. We know it's a illness which should occur within 2 weeks to 3 months of stressful event and resolve by its own within 6 months. It is of the following type: depressive type, anxiety type, conduct type. What do you mean by type? Symptoms are sub-syndromal. They are not persistent, pervasive in every situation. They are not meeting a syndromal diagnosis. So in this case also we have seen it is after a loss of job and there is a fluctuation. Somewhere he could enjoy, somewhere he could not. That's a adjustment disorder. So it is symptoms are like of a depression or anxiety, but they are not meeting a syndromal criteria. Now that's a question about the nocturnal anorexia. And we know nocturnal anorexia, the treatment we all have been trained and learned is the alarm therapy and the pad and bell therapy. Pad and bell therapy is a age-old treatment for the nocturnal anorexia, recommended by still the guideline that pad and bell based classical conditioning. ठीक है डॉक्टर साहब. So that's the nocturnal anorexia. Very good, Dr. Kiran D. Yes. Now patient with the severe depression with TCA. There is an improvement in symptom after 4 weeks. Which of the following is the most important concern at the time of a discharge? So we know that answer is the A. Very good, that's all. We know overdose of TCA causes death well done Dr. Subin, by cardiac arrhythmia. And we know we had an MCQ that what it does? It does the widening of QRS complex where we can give the sodium bicarbonate. There is a QTC prolongation where we have to do the cardio version or DC shock. Well done Dr. Subin and Dr. Kiran. आप ही जवाब दिए. So that's so in the TCA routinely we don't do the arrhythmia monitoring and we don't do the drug monitoring. Though the drug levels are available, but usually done in the Western countries, not available in our country. Also not cost effective. Also. So answer is because we know the TCS because the depression improves. We all remember in psychiatry we have been trained that there is something, the most common phase of depression. The most common phase of depression for suicide is, it's a depression in recovery. Depression in recovery. Also been called as the paradoxical suicide. So since he is improved from depression, there is a possibility that he may attempt suicide, and that could be disaster because the cardiac arrhythmia lead a severe death. Hello Dr. Saab. Welcome Dr. Kiran and Kiran Reddy. So please join us also tomorrow for the question if you wish. We'll enjoy. We know that delirium from dementia in Alzheimer's disease. So how will you differentiate the delirium from dementia and the Alzheimer's disease is going on? So the delirium will be having a acute onset and the level of consciousness. So delirium will always have a disorientation, but there will be a acute onset for the delirium. The dementia will be a gradual insidious onset. Very good Dr. Saab, Gokul ji. Answer is C. To psychiatry for final year. See, we teach psychiatry in 16 hours, but if you read, I don't know how much questions they ask you nowadays. But it need at least 20 hours तो देना चाहिए डॉक्टर साहब. 20 hours तो नहीं है. Delirium will be acute onset and the level of the consciousness. Now voluntary purposeless movements and stand still. बताइए डॉक्टर साहब. What is the appropriate immediate medical management? A psychotic patient है, voluntary movement है, stereotypy है. So what is the appropriate medical management? Propranolol क्यों देंगे डॉक्टर साहब? सुबिन साहब. So we know it is basically a catatonia. Treatment of choice is electroconvulsive therapy, but we may try the injection lorazepam. Injection clonidine का कोई यूज नहीं. डॉक्टर साहब clonidine क्यों लगा रहे हो? Clonidine has not a use. It's a catatonia. Treatment is electroconvulsive therapy, but till the time you prepare the client for the electroconvulsive therapy, we give the injection lorazepam, and sometime the symptoms of waxy flexibility, negativism and stereotypy, they improve for short time with the lorazepam. Ultimate treatment is the haloperidol, but that is the ultimate treatment. Immediately management क्या करोगे? Because it is a case going for a charadonia, we will try to resolve immediately with the help of injection lorazepam. Very good, Dr. Sanjay and Dr. Gokul and Dr. Kiran. Why clonidine, Doctor Sahab? Why are you saying clonidine? B क्यों कह रहे हैं? No. Benzodiazepine and preferably the injectable lorazepam, short acting lorazepam. Now that's a controversial question. Now again once been asked in the INI-CET. The controversy has been resolved, but though you tell us, we know it's a case of a obsession, and we know the obsession is a disorder of the Dr. Sanjay is enjoying the lollipop MCQs. So this also we have done. INI-CET में भी किया था हमने. So other than the charadonia question and this Alzheimer's disease question, most of MCQ we have done in the our revision of the predictive MCQs. So now we know obsession is a disorder of the possession of thought. Number बढ़ गया, answer कम दे रहे. It's a disorder of the possession of thought. We all know MCQ at the NIMHANS has been asked many years, different between the obsession and delusion. Delusion is a disorder of the content of thought. That's how it is D. For sure it is D. There are two schools of thought, but from where the obsessions has been derived, the fish psychopathology, they described it under the possession of thought. Delusion we all enjoy. I enjoy being Lord Hanuman. I enjoy being Bill Gates. So it enhances my ego. It's a ego syntonic experiences. Obsession is a ego alien. Ego alien. Or that's up. I can't think so bad about God. Ego dystonic. So we had an MCQ. Obsessions are disorders of the possession of thought and they are ego dystonic. They are distressing to my ego. So please trust us. No confusion. Obsession is a disorder of the possession of thought. Now that's what we have been knowing now. So as per the DSM-5, it has been placed under the category of a selective mutism in children is an indication of a. It's an indication of a childhood anxiety, childhood depression, or what? No, that's a boy good. It is a disorder of, it's an indicator of a childhood anxiety. So the selective mutism has been placed under the category of a separation anxiety disorder or sort of a anxiety disorder. No doubt, sir. It is not depression, it's a childhood anxiety manifestation or indication. So that's the MCQ. Also we have discussed in the predictive MCQ. So out of the list of 10, we predicted this. Okay. So that's it we had for today. All the 10 questions. Selective mutism is an indication of a childhood anxiety, and obsession is a disorder of the possession of thought, and the for charadonia we give the injection lorazepam, and you remember we have a question that delirium differs from rest of psychiatry in. Delirium differs from rest of psychiatry in disorientation. Delirium differs from dementia in disorientation. So in psychiatric illnesses, there is a disorientation. ठीक है डॉक्टर साहब. So level of consciousness. So, and then this question also we have discussed, and the TCA overdose also we have discussed in some other form, but that's a different MCQs. So I welcome you all to join us the platform of Unacademy, and that's we know it's all free session. So join free sessions with my referral code and enjoy the learning of all the subjects. It's not that if you join with my code, you can have access to all the free special classes happening on the platform of the Unacademy. So that's for today, the INI-CET. So thank you, Dr. Saab. Thank you so much for joining with us. So you can always join us the Unacademy platform for any of the special classes. So beauty of this platform is it is like a Netflix of the medical education. You open anytime, some or the other special class going on, some routine course going on, and the beauty is that if once you register, you can have access to it anytime you want and can download the PDF of it. Tomorrow time is always 10:30. My special time is 10:30 p.m. This we have discussed. This is what is the time. So every Thursday, Saturday, Sunday, 10:30 p.m. to 12 a.m. and every, So every Tuesday and Friday, we keep So Friday usually we discuss the case studies. ऐसा कुछ नहीं डॉक्टर, no dose is defined, not low dose. See, it's a good dose. If you ask me the benzodiazepine dose, it is around injection lorazepam. You can give even 2 milligram IV TDS. So at such low dose का बात नहीं है. You can even give 4 milligram IV TDS. So to resolve the charadonia. In these places where the electric shock facility is not working or not available, you manage the charadonia with the injection lorazepam. Ultimately, treatment is treat the main illness, and main illness is the either schizophrenia or the mood disorder. So as such, there is no low dose. It's a good dose of benzodiazepine being given for management of the catatonia. Thank you so much, Dr. So see you tomorrow with the multiple MCQs and another round of the appropriate MCQs, the planned MCQs. So good night for today. Thank you so much.